Yep,
Is it live now?
you're live.
Well, good morning. It's Dr. Shiloh, and I'm here with Linda, who has so graciously agreed to film her procedure from a patient's perspective. And today we're going to be ablating her right greater saphenous vein, which is causing her some significant problems. She spent a lifetime on her feet as a hairdresser, and so she's got some varicose veins and pain, and we're going to treat them with this GSV ablation. So the first step is, if Linda wants to show us, I'm going to numb her skin up real quick. A little pinch, okay, Linda?
Mm-hmm.
And then if you can see the monitor there, I don't know if you can see it. Can you see it well, Linda?
Yeah.
So what I'm going to do in a minute is, which one am I doing? Okay. What we're going to do right now is access the vein here below the knee. So we've numbed her up, and now if Linda focuses on the ultrasound machine over there, we should be able to see, hopefully, we'll see a needle, little white object come into view. Pop. And now I'm in her vein. Okay. You guys look at this here now, so, you know. So now we're going to put this little wire in.
I don't feel anything, just so everybody knows.
Yes. And then it should be relatively painless here. Gonna make a little nick here. Now we're going to introduce the sheath. A little push, okay? You might feel a little pressure. Okay, perfect. Now that's in. Okay. All right, I'll take the device, please. So then we're going to use the Covidien Closure Fast Endovenous Radiofrequency Catheter. Okay, it's 7 centimeters long. Every patient gets a brand new device every time. Which can't always be said for other things like lasers. So we'll open it up, and then we're going to introduce the catheter all the way up to her groin, where the problem originates at the junction of the common femoral vein and the greater saphenous vein, called the saphenofemoral junction. So we want to introduce the device so that it's about 2.5 centimeters from the junction. And once we have it in position, the next step will be that we're going to numb her leg up. So far everything's going great. Just waiting for the device here. So this is actually the device. This is the heating element right here. It's going to heat up the vein to 120 degrees Celsius in a few minutes. But that's why we have to numb everything up real quick here in a second. All right, so the device has been hooked up to the box. If you want to show the box over there, you see. Okay. So now I'm going to introduce the device. It's going in through the sheath. And then Linda shouldn't feel anything as it goes in. There's no nerve endings inside of veins.
Nope, don't feel anything.
So now what we're going to do is we're going to ultrasound here by her groin. You can look at the ultrasound. And actually we have a very nice demonstration there of the catheter is that bright object right there. And that's the junction. So I have to try to get a good picture of it here and make sure that it's not too close. I'm going to pull it back a little bit. What's ringing?
Phone.
In here?
New phone.
Okay. I didn't know we had a new phone in here.
This morning.
Oh, it's, okay, so right now let me just get this in view. There's the device right there. Tracy's going to freeze it. And we're going to measure from the tip of the catheter, or the device rather, to the junction. So it's about 2.5 centimeters, which is perfect. And we're going to leave it there. We're going to do one more measurement to confirm. We always measure twice. That's why we've fortunately never had a DVT here, because we don't burn too close to the junction. So again, I got to find, there's the device, the tip of it right there. So I turn on it. See, it might, there we go. So Tracy's going to measure it again for me. Yep, perfect. Okay, so now that the device is in place, I'm going to flatten that a little bit. Now we can lay her back down a little bit. So this is the part got the freezing spray. So here at our office, we try, of course, to make this as comfortable as possible. So we use what's called ethyl chloride, which is a freezing spray. You've seen some athletes getting it, and we're going to be using that so that she doesn't feel the needle puncture. And so I'm just looking for my, here we go. I have a foot pedal. It's connected to the bag of lidocaine called a Klein solution, 2-methyl lidocaine. And now we're going to numb around her vein. There's a little bit of air in there. Okay, so Tracy's gonna put some freezing spray on there. You're gonna feel a little cold on your leg.
Okay.
And then we're gonna put this little needle in here. And what it does is it surrounds,
That's really cool.
you can see there's a couple bright lines there, and there's the needle is right on top of it. You'll see a better look at it later. There's the catheter and there's the needle. See what's happening is there's the needle right there, and there's the catheter, the double line. And as I inject this saline, it's gonna track along where the catheter goes and surround it. You see how it's actually
It feels kind of,
tense?
yeah, tight. That
Yeah.
would be a good word.
Well,
yeah.
it does get a little tight because we're filling a space that was not filled with fluid with more. But then I guess the other thing is the knee. I always tell patients a little bit sensitive. But oh, look at that! See what happens? Watch when I inject it. See how it
Oh, yeah.
spreads the tissue. And there's the needle sitting right on top of that. That's the difference between having an intervention radiologist do this and someone else. You know, the ultrasound part of this is the most critical part to make this as comfortable as possible with as few punctures, so I can advance the needle. And you can see the fluid traveling along the vein. Isn't that cool?
Yeah, that is.
That's called, the tumescence is now moving along. So then we get to a point where we stop. Not too painful at all.
No, not at all.
So again, there's the needle again, and it's sitting. We want to get it as close to the edge of that as possible. See? And what it's going to do is it's going to keep traveling. See, as it travels, it's surrounding your vein. The vein is in a special compartment. You can see it's filling that space. See that? Pretty cool, right?
It's amazing. Yeah.
So then once we get a little further forward, we go there. So far this is like maybe the 4th needle puncture maybe. It's going very, very well for you. There again is the needle going into the compartment that we want it to be in. Even sometimes I go through it and go underneath to make sure the vein is completely surrounded. You can see going very nicely. So keep moving. So what's going to happen is the reason that we're doing this so that people understand, all 3 people probably watching, is that this vein was what we refer to as refluxing. What that means is that the blood is going in the wrong direction, just like reflux when you eat a chili dog and the acid and food go up the wrong way and your chest hurts. Well, when the veins reflux and the valves are broken, it causes too much blood to pool in the legs, and that then leads to people forming varicose veins. You can see how nicely the fluid is traveling there and surrounding that bright line. That's the catheter inside the vein.
That's just really neat.
And we're getting close actually to completing this part. Once this is done, we're going to ablate the vein, and she's not going to feel a thing. See, there's the needle again, right up against the catheter. So far, so good, Linda?
Yeah.
And it's traveling along there. And so once we are prepared, which is going to be in a minute with the entire vein surrounded, so right now you can actually look at the device. See how it says 32 degrees Celsius?
Mm-hmm.
In a moment, it's going to drop down to the low 20s because the vein will be completely surrounded with fluid, and thus it'll be insulated, and then that's one of the ways we gauge if it's time to, that we know we're in a good spot. So not only can we visually see it, like here, I could see, look, see there's the nose of the catheter right there at the very end right there. It's getting surrounded. What's the temperature say on the device now? 22 degrees, right?
Mm-hmm.
So that means we're pretty good. We're gonna do one last little bit here. Make sure you're completely insulated. And we'll be done with this part, which is really the, see right now my needle's right against the tip. It's tickling it right there, see?
Mm-hmm.
And I'm just gonna give you more saline there so that there's absolutely no chance you're gonna feel any of this. Good, okay. And now we're ready. So what's gonna actually happen is, I'm gonna compress the vein here. And we're gonna turn the device on.
Ready?
And let me just get a better look at it. Got it backwards there now. There's the catheter right there, the little double line.
Right.
Right. For people who are watching. Right here is the tip. And I'm gonna ask Tracy to hit the button. It's gonna turn on. And we're gonna probably see this thing make some air bubbles here in a minute. Right there. See?
Oh, yeah.
That's the vein cooking. See what's the temperature in there?
Sorry. Sorry, Doc.
120 degrees Celsius. For all you math mavens out there, that's about 250, 60 Fahrenheit. Did you feel anything?
No.
Right, so go ahead. So 120 degrees Celsius is obviously hotter than boiling water. Water boils at 100. So actually what you're seeing there, that white is the vein being ablated. So that's small little air bubbles being formed by the burning of the inner lining of the vein.
Okay.
But she's not feeling a thing because we did a good job of surrounding the vein. So now all we're gonna do is pull this back 7 centimeters. So I just pulled this thing back.
Okay.
Okay, and we're just gonna repeat it. So now that's all, as we move down the leg, there's the catheter again, right near the, right there.
Yeah.
And then we're gonna turn this back on again. See, you can see it's working right there. There's the bubbling. I always tell people it's just like if you were cooking a piece of a burger on your grill, you know, it puts off steam, right? So that's what you're seeing there, and that's ultrasound. Bubbles look like those white increased, what we say echogenicity in ultrasound, but just that extra white. So what we do is we burn each segment every 7 centimeters. We burn them for 2 separate burns, and it's a 20-second burn each time. So right now we're near her upper thigh, and we're gonna work our way down the leg. You can see it's essentially a bloodless procedure. The hole that we put in her upper calf is probably no more than 1/4 inch wide. So now we're gonna pull this back again, another pull back to the next spot. Turn it on again. I mean, Linda's gonna be done here in about 2 or 3 minutes. You can see right there, there's actually a nice demonstration of the active zone right there working. Right there. That bright white line there in the middle of the screen.
Yeah.
Any questions, anybody? How many people are on here? 0?
I don't know how to tell.
I might say how many were watching. Doesn't say.
Nobody.
Maybe nobody.
But you can access this
Later, yeah.
later.
Mhm. If not. 6 all right. Okay, so we're going down to the next segment. Did you measure for them?
No, I can't.
Right there you can actually see the device is working just above where the arrow is. There's a little bit of movement there, and that's where the device is working. Sometimes it's hard to see amongst all the food. Yeah, this part's kind of like flying a plane on autopilot, you know. You just have to keep pulling it back and ablating. But that's it. Wasn't too bad, huh?
No, not bad at all.
I mean, and now, as I said, we've already gotten about this much plus 7 centimeters of catheter above it, ablated. So we're going to pull this back again. So now we're 11 centimeters away from the end here. So we're kind of right around her knee at the moment. And what's going to happen is this malfunctioning vein, because the valves in the vein are broken, it previously, obviously before we ablated it, it allowed blood to go down the leg instead of just up. So the old treatment many years ago was called a vein stripping, and they would make multiple incisions along the inner thigh and physically pull this vein out. It was obviously much more traumatic. Many patients who've had it said it was really rather bad. You were in the hospital for several days, your leg was bruised for a month. So this procedure has largely replaced that. There is another procedure people hear about a lot, which is EVLT or laser, and they both do effectively ablate the veins, but studies have shown that RF ablation is better tolerated by patients in the first month or so, and because several reasons. One, and most important, is that the heat is controlled at 120 degrees as opposed to laser, which is probably closer to 350 or 400 degrees Celsius, and thus there's a lot more pain and bruising associated with it. They're both effective in the long run, but like I said, studies have shown RF is more patient-friendly, and because of that, that's what we use. We only have RF as far as ablation techniques here. We also have another product called VenaSeal, which is vein glue. It's sort of a newer thing. It's only been out for about a year, or one of the few places in the area using it. That's 7. So we're going to pull this back.
Just so everybody knows, I don't feel anything. There's no pain.
Okay,
Yeah.
I guess I'm going to renumb this for those a little bit. I'm just going to add a little bit of numbing here. Sometimes I like to do that at the very end to be 100% sure that the whole thing is numb. This is going to be the last ablation, actually. And as I was saying before, we also have VenaSeal, which is vein glue, which is a newer product. It's been out for about a year. It's FDA approved, but the insurance companies currently don't pay for it. The real benefit of VenaSeal is that you don't have to do any of this messing part. So for people who are really needle phobic, you don't have to do any of this numbing around the vein because you're not heating anything. So that's really the true benefit of it. And then you can cover this up with a Band-Aid and you can go right back to your normal activities. Now, that being said, even with RF, we will surround your leg in a moment with a wrap, and then encourage you to wear the compression stocking for a week. But you can return to any other normal activity. The only thing we sort of advise against is heavy lifting, so squats, bench press, but we have patients who go back to running, walking, jogging, riding bikes, etc. 2 days after the procedure. So when she walked in, she's going to walk out, and actually as soon as she leaves here, her leg will start to improve because this malfunctioning vein will no longer be there, and the body's going to have to reroute or redistribute the blood to the normal deep venous system. So we're actually done. Take the catheter out. You can see there's really been no change in it at all. And we're going to take this out, little sheath, and you can see there was no bleeding at all.
No.
We do then do a little bit of a gentle leg massage to try to express any blood out of there, which is minimal. That's it. And we're going to take a couple pictures here, make sure everything looks okay. So this is the post. So we're showing that the common femoral vein looks fine, the compression. And then That's what her ablated vein now looks like. And that's all. Then the girls are going to wrap her leg up, and she'll be walking right out of here. So whoever was on, all one or two of you, thanks for your attention. And thank you to Linda for filming it. I appreciate it.
Thanks, Doc.